My name is Rachel and I'm going to be your student nurse today. Can you please state your full name and date of birth?
Betty Jones, 5/21/52.
All right, Mrs. Jones, thank you. So today what we're going to be doing is we're going to be giving you a blood transfusion, okay? It looks like the doctor ordered it because of your blood loss, okay? Have you ever had a blood transfusion before?
No.
No? So this is your first time, so you've never had a blood transfusion reaction?
Nope.
Okay, so during this procedure, we're going to be giving you blood, and sometimes a reaction can occur. So we're going to be monitoring you fairly closely or very closely, just to see if you have any dyspnea, so a hard time breathing, if your respiratory rate changes at all, if you're having back pain of any sort, a fever, maybe some itching. So it's really important as we do this that you let me know if you feel any changes at all, okay?
Okay.
It's better to be safe than sorry. So just let me know if you're feeling any different. So it's also important during this procedure that you're able to follow commands. Do you think you'll have any problems with that?
Nope.
Okay, so now I'm just gonna verify that we have the right IV. So it looks like you have an 18 gauge in, which is perfect. We generally like to work with 18 to 22 gauge needles, but the bigger the hole the better, so the blood can flow through it easier. We've already obtained your signed consent form, so we're all good there. Before we begin, do you have any questions?
Nope.
No? Okay, so I'm just gonna look here. We've got your normal saline. Normal saline is actually the only thing compatible with blood. So I'm just checking the expiration date, making sure it's not expired or anything like that. It's not cloudy. We're also gonna ensure that your IV has patency. So I'm gonna take a 0.9 normal saline flush. I'm just gonna make sure that it flows through. And it did. So it's now saline locked. And what I am going to do now is check that. So I'm going to obtain a full set of vitals. So I'm just going to take all of your vital signs and I'm going to do a complete respiratory assessment, just to make sure that we have a good baseline before we begin, so it's easier for us to notice if anything changes. Sound good?
Okay.
Okay, so we've obtained that. Now what we're gonna do is we're gonna look at your blood. So my second nurse brought up my blood from the pharmacy. It's important to note that after the blood is out of the out of the cooler, it can only be at room temperature for 30 minutes. So the the transfusion has to be initiated within 30 minutes. So it's very important to start that right away. So with my second nurse, we're just gonna verify that we have the right blood type. So med record 224466.
224466.
Account number 123456.
123456.
Patient Betty Jones.
Betty Jones.
Red armband 456654.
456654.
Patient blood type is B positive.
B positive.
The donor is 7890.
7890.
Unison pool 4.
4.
Blood volume 250.
250.
Packed red blood cells.
Packed red blood cells.
Expiration date is 05/22/2020.
5/22/2020.
At 2000.
At 2000.
The donor blood type is O positive.
O positive.
B positive, O positive are compatible, and there was a compatibility test completed
Completed.
on the 01/02/2020.
01/02/2020.
Okay, now we're just gonna check the red armband number. So we've got 456654.
456654.
We've got Betty Jones.
Betty Jones.
05/21/1952.
05/21/1952.
Okay, good. So it looks we've got the right blood here. So I'm just gonna tilt the blood back and forth. I'm gonna make sure I don't see any clumping, any separation, anything that looks abnormal in the blood. Per agency policy, some agencies like to use blood warmers or things like that. So you just need to check for the agency policy. So now what I'm going to do is I'm going to wash my hands and put on gloves. I am going to prime the line with my normal saline. And I think I'm tubing out here.
No, I totally get it, but that's why.
So I'm going to take this connector and maintain sterility. I'm going to throw this away. I'm just going to put it in my pajamas. Just make sure I don't touch anything like that. Spike my bag. And sure the roller clamps are closed before I flip it upside down. So let me fix this. Close this. The roller clamp is closed. So now we've got 0.9 normal sodium chloride, which is compatible with blood. So I'm going to open this up and I'm going to prime the line. There's a lot of bubbles. We got some big air bubbles in here.
Oh my gosh.
I know. Do you think I should keep messing with it or verbalize?
No, I would just verbalize.
Okay, so normally I would spend my time getting all of these air bubbles in the line, but for sake of this video, I'm just gonna say that I have all my bubbles out. So now I'm gonna just take my line and I'm gonna spin it here until I'm done for it. Okay. So now what I'm going to do is I am going to my blood. And I'm gonna close the clamp for this. Of course, I have to make sure this is past the filter. So when I prime the line, I have to make sure that this goes past the filter so that the blood cells don't hit it and break. So now maintaining sterility, open that up. And here. So I've got closed. I'm gonna open up my red blood cells here. And now I'm gonna prime the line with my blood. Because I'm going to be in the room with the patient for the first 15 minutes, and if it's just normal saline in the line, I won't be with them while they're receiving their blood. So I'm going to follow the pink solution. And it travels down my tubing to ensure that I'm not wasting any blood. Okay. So we've got to the end almost. A little bit. Okay. So we've got to the end. So I'm gonna grab my alcohol. Hopefully. and insert. Now, because these are kind of messy, I'm gonna take these off. I'm gonna wash my hands. I'm just gonna put on clean gloves just because there's some sealing on those gloves. So I'm just putting my Alaris on. So I've got blood. So I'm going to run it for 50 milliliters an hour for the first 15 minutes. And then after that's done, I would bump it up to whatever I feel like the patient could tolerate. And we have a 250 ml peg, so I'm going to put it at I'm gonna put it at 225, just so the bag doesn't run dry. And then when we get back, we'll finish that. And I'm just gonna hit start. I'm gonna make sure that's open. Make sure this is open. And then I would need to stay with my patient for the first 15 minutes and monitor them very closely. And then I would need to take vital signs every 15 minutes for the first 30 minutes. And then after that, for the first hour, it's per agency policy. And then after that, I would need to monitor vital signs every hour until completed. Then do another full assessment once the blood transfusion has finished. Once the blood transfusion gets closer to the end and it gets finished, I would finish running this, and then when it's done, I would change it. So it would be running the normal saline, and the normal saline would flush the red blood cells out so we get the full dose. So once this gets emptied in there, we would open this, and we would run at the same rate that the blood cells are until we get normal saline. And then I would take a 10 milliliter syringe of normal saline, and I would just flush the line again, and just be monitoring my patient. So modifications across the lifespan, some considerations would be, if it was a kid, just again, making it kind of fun, maybe explaining what's gonna happen, just letting them see the things, being able to touch things, things like that. The most common the most common reaction is like the allergic reaction. So we'll see a change in temperature with 2 degrees, an increase of 2 degrees in temperature. And then I would document when the blood was administered, the site, the gauge of the needle, how the patient tolerated it, and things like that. And then I would clean up everything. I would ensure my patient is safe and comfortable, and I would clean up all my supplies, and then I would be done.